Welcome to this episode of Jing TV, where we're going to talk about working with people who are living with asthma. And, you know, it's always really interesting to talk specifically about particular pathologies.
Yeah.
And, you know, we have dedicated a course specifically to working with the ribs, thorax, and abdomen, which I do believe you designed.
I did design it, it's true.
So, you know, it's one of those conditions where, again, it's thought about from the medical industry around lung capacity, and there's a lot in it, and there's a lot about why people develop asthma, but it's also just about creating space. And actually massage therapists are really good at creating space in the body. So if I said to you, Rachel.
Yes, Megan.
What would be the way that you would start to work with somebody who had asthma? What are the couple of things that you would like to share with our viewers?
I've got so much to share with the viewers. So first of all, you can have a really positive effect without a doubt. I've worked with a lot of clients with asthma and other breathing problems. So think about the soft tissue structures that might be involved in constricting the breathing. So the major muscle of the breath is diaphragm. So there is some great, in fact, let's all feel our own diaphragm. Ooh, I say. So curl your fingers, and then if you just sort of slump forwards and hook up into the, up and under the ribs and take a deep breath, you should be able to feel the diaphragm.
Beautiful, like mushroom. It's
stunning. It's absolutely like a mushroom or a jellyfish inside the belly. So what the diaphragm does is it's actually, when we breathe in, it flattens so that we draw air into the body, and when we breathe out, it kind of pushes up like that and pushes the breath. You're testing your own diaphragm now. So we can get lots of trigger points and fascial restrictions in here. So there's some really good techniques you can work the diaphragm. Other muscles of inspiration are intercostals actually, are more major ones. So the intercostals, if you want to feel between your ribs and take a deep breath in and out, you'll be able to feel those muscles working. So we can do lots of really specific work.
And you can, and it doesn't really matter when you work in the intercostals if you work from medial to lateral, if you work kind of superior to inferior. You just want to clean those spaces between the bones. And how you can work them is you can work them, well, I think supine, but particularly also I find a lot of joy working them. A lot of joy. Get a lot of joy in working them side lying.
Okay, I agree with side lying. I think it's all three, isn't it? It's front, back and sides.
Ooh, Ida.
Ooh.
Ms. Rolf. Okay, so, working through, and although we're talking about asthma today, I was just remembering being pregnant, and also all of my pregnant clients who start to really have a hard time breathing towards the end of pregnancy, and working through those intercostal muscles can really make a difference.
And you get loads of trigger points in there as well. And you also around the sides get portions of serratus anterior also, and there's very often a trigger point about halfway of the body. So serratus anterior, also a major acupressure point.
Just
spleen 21, same brain. 21. So diaphragm, intercostals, and then what we call the secondary muscles of inspiration are things like the scalenes. So the scalenes are attached to the cervical vertebrae and then to ribs 1 and 2. So if you find your SCM going to the side of your neck, and then just
3 sharp breaths through your nose.
Sharp breath in.
They kind of pop out. And I feel like when I do that, I really understand why the scalenes get really tight, especially like people are driving and they're a bit constricted and stressed out. So when they start to tighten, you could feel all that breath.
And trigger points in the scalenes can cause pain down into the chest, between the back of the shoulder blades. So if you release these really commonly tight because of stress, then that really helps open up. And pec minor as well as another accessory muscle of inspiration. So to feel that, just come into the corner of your chest, if you like, and you might feel like a little bit of a speed bump. So it's running from coracoid process down to ribs 3, 4 and 5 here. Come in and sort of feel that speed bump. And that also helps to raise the ribs.
So working with people with asthma, I think there are probably 2 things. There's like the functionality of all that musculature, right? Well, there's probably 3 things. Functionality of all those muscles that we mentioned. So being able to be specific and working them for trigger points. Obviously also working fascially. Obviously. So lots of cross-handed stretches, a lot of opening up through the areas that might be restricted, recognizing their postural assessment. So classically they might be slightly kyphotic. They might kind of internally. So you're trying to open them up and open through the chest. And I think the third aspect of that is working on panic.
Yeah.
Because a lot of people who live with asthma recognize that different things in the environment might change their breath, and losing your breath can be very, very frightening, even if you know you're asthmatic. So people might have their inhalers and kind of use that a lot, but also working on helping people to find their feet, do some grounding in the moment of panic. So that might be they've pushed themselves a little too far one day walking up a staircase, or, you know, I found a client I was working with said their asthma attacks also kind of on the border of panic attacks. So for instance, if they're feeling like they need to push themselves up a staircase when they're in the subway or the tube and they can't really stop to get the inhaler, all those kind of, even though they've got only 4 more steps, it's like those kind of things. So I guess for the advanced clinical massage approach, which we've been talking about a lot today, is the idea that, you know, you're dealing with a whole person, deal with their asthma.
Yeah, but grounding, being here in the here and now, because we are being asked to wrap up. But I was just thinking, because I was musing as you were talking. I was thinking, oh, you know, self-care exercises and meditation and mindfulness.
Absolutely.
Obviously, one of the key exercises is tuning into the breath for mindfulness. But I was thinking that's probably not such a good thing for people if they're having a bit of an asthma attack, to focus on the breath. So actually teaching things where they become aware of the environment
and dropping the breath down,
you know, really becoming grounded. So a lot of good stuff that you can do there, and I've had great results with clients with asthma, and also just clients who are generally exhausted. I mean, I think we all need an increase in our breath capacity. The breath of life is what.
Oh, that's nice. I'm going to end it on that. So increase your breath of life. Hopefully Jing is a good breath of fresh air. And come hang out. Come hang out with us on Jing TV or Facebook, Twitter, and also, of course, come visit us in Brighton one day, and we hope to see you soon. Rip Thorpe and Admin. Awesome masterclass.
Awesome.